Because stunting is a complex problem, nutrition interventions alone are not enough to prevent it. Nutrition must be integrated in development strategies. This is because government and other structures that influence economic policies, markets, and the provision of services can importantly influence food insecurity and undernutrition among the population. The political economy drives the availability, cost, and access to food. Social protection programs have demonstrated a positive impact on poverty reduction in some countries, but their effects on stunting rates have been limited. International regulatory policies, such as the International Code of Marketing of Breast Milk Substitutes and food safety regulations, are important instruments for countries to use when dealing with questions such as how to ensure nutritionally adequate diets for children in populations affected by food insecurity, how to avoid displacing breast milk and locally available nutritious foods by commercial products, and how to protect children from harmful feeding practices that could increase the risk of obesity. Doctors, nurses, and other health workers are responsible for screening and identifying children at risk of inadequate growth and development. In many countries, community-based maternal and child health clinics, child health days, and lay community health workers deliver a significant proportion of nutrition interventions in the area of breastfeeding and complementary feeding. In overstretched health facilities, too little time is invested in nutrition counseling, and for many countries, assessment of stunting remains a challenge due to lack of skills and time to assess growth in height and link it to counseling. The education of parents and others caring for young children is an important predictor of child health and nutrition. Improved female education was responsible for an estimated 43% reduction in undernutrition between the 1970s and 90s. Higher education can improve caregivers' ability to understand and change nutrition-related behaviors and practices. Cultural beliefs also influence food choices and behaviors. When a young child is fed a variety of foods, this affects their food preferences later in life. Deeply held beliefs can also impact a child's health when they influence the types of foods offered or how they are prepared, what types of food should be introduced and when, who can and should feed young children, how to feed children when they are sick or simply refuse to eat, or how food will impact a baby's sleep patterns. Promoting a diversified diet in infancy is likely to establish lifelong healthy eating patterns, but caregivers with limited incomes may worry that providing foods such as meat or eggs to young children could establish food preferences that they cannot sustain. Agriculture encompasses food and cash crop cultivation and livestock production. Trends toward production of single crops and heavy dependency on grains, seeds, or pesticides may be contributing to a lack of diversity in people's diets, leading to micronutrient deficiencies and destruction of local environments. Small livestock production is a promising area where agriculture could enhance nutrition. Milk and eggs are nutrient-rich complementary foods, and poorer households in both rural and urban areas could feasibly raise their own animals and poultry. Contaminated water and poor sanitation are important underlying risk factors for unhealthy growth and development. Together, they are estimated to cause 5.4 billion cases of diarrhea and 1.6 million deaths each year. Environmental contamination, such as filth on floors, are particularly important to young children as they explore their environments through crawling, early walking, and putting objects in their mouths. The proper disposal of feces and animal waste, as well as regular hand washing, are critical during this sensitive age. The provision of toilets and improvements in water quality are important ways to prevent intestinal diseases and thereby reduce the risk of stunting. Stunting and its consequences arise from a complex mix of factors. Research, programs, and policies need to be informed by the determinants of stunting at household and wider community level in order to design adequate approaches to promoting healthy growth and development. There is tremendous momentum to refocus investment in programs and research on improving nutrition during the first 1,000 days of life. This conceptual framework can help guide policies and programs for improved maternal, infant, and young child nutrition to keep future generations growing healthy and strong.